I think the one thing that I want someone to know about ASTHO is that we are always working hard toward a common goal here. And that goal is to be the best association that we can be. I think all the time while providing our membership with the technical assistance and advocacy on evidence-based and promising public health practices.
I would describe ASTHO's work culture as very collaborative, dynamic. There's always something new going on. There's always some exciting new project that people are working on.
I've seen over the years how ASTHO has adapted to change and tried to think about their staff in the way that things are progressing. Especially this past couple of years with the pandemic, ASTHO has really stepped up, the leadership has really stepped up in trying to make sure that staff feel comfortable. We
have great expertise in our executive leadership team and throughout the ranks here at ASTHO. What I've been able to find here is that the skill sets that individuals come with are second to none.
I think ASTHO, if you're really wanting to have a really good introductory career path into public health here in the United States, working at ASTHO is a really good beginning, to start all of that.
One of the things that I think ASTHO does a good job of, and I expect, I guess, most leaders would do, is to give ownership of projects to the staff. And I think seeing staff take a project from start to finish, and it's their baby or their product, of course they'll be working with a team, I think is something that I was given that opportunity as a staff person starting at a very junior level, and I would continue that tradition, and that's something that I'd like to do with my team.
One of the biggest things that I appreciate about ASTHO is the staff. I've developed friendships with many people. I've seen them come work at ASTHO out of school and graduate school and go off and get married and have children. And so, you build those friendships over the years, and then sometimes they're friendships that you have for life.
Everyone cares about their work, but also cares about each other. So I think that's one really important thing to really recognize, especially when it comes to working in a virtual space.
One of the things that ASTHO has done now, we've actually become a work from home association, if you will, meaning that even when the pandemic is over, we will still be working from home. There will be times during the year where we'll have to go into the office, but ASTHO is a virtual employer.
I have to say the health benefits at ASTHO are really great compared to other places that I ever worked in.
We have over 11% that they put into our retirement fund, which is definitely a perk. We also have the employee assistance program. It's there to help us through difficult times or anything that problems we might be dealing with in life. It's a full package, and it definitely is something that attracts people to our organization.
The other great thing at ASTHO is you get to rub shoulders and interact with public health leaders at the highest level, whether it's at CDC or within public health agencies. That's an opportunity that you don't get to see in any other organization. So most people I've known at ASTHO have either moved on to do bigger and better things within ASTHO or have moved on to do bigger and better things outside of ASTHO. It's not that we want to see people move on, but it's the connections that you make while working at ASTHO that's certainly an asset that I haven't seen in other organizations.